Welcome to another short from the Vet Med Digest. Canine Transitional Cell Carcinoma, or urothelial carcinoma, is the most common malignant tumor of the dog's lower urinary tract, typically presenting as a high-grade, invasive cancer. This disease poses a major clinical challenge, often leading to distant spread in over 50% of affected dogs upon death, but its immediate threat often stems from local complications. Transitional cell carcinoma commonly targets the trigone region of the bladder and the proximal urethra, leading to a life-threatening complication, urethral obstruction. Recent research confirms that both urethral obstruction and a concurrent urinary tract infection upon presentation are significant negative prognostic factors for overall progression and tumor-related death. Because complete surgical removal is usually impossible due to the tumor's location, medical therapy is the core of treatment, yielding favorable responses in approximately 75% of dogs. Immediate management for obstruction can involve placement of urethral stents or cystostomy catheters. However, modern chemotherapy is rapidly proving crucial for managing this emergency. In a study of dogs with urethral obstruction at admission, 6 out of 7 successfully regained urethral patency after the first dose of systemic chemotherapy, typically vinblastine or gemcitabine, avoiding immediate need for complex interventional procedures. Long-term control relies on systemic agents, typically combining cyclooxygenase inhibitors with chemotherapy like mitoxantrone or vinblastine. Gemcitabine specifically demonstrated a reduced risk of distant metastatic progression in dogs with urethral transitional cell carcinoma. Furthermore, metronomic chemotherapy, involving frequent low doses of drugs like chlorambucil, offers an excellent safety profile and has shown significantly longer median survival times, 303 days, compared to other approaches in certain populations. Looking ahead, innovative diagnostics and targeted therapies are emerging. Surface-enhanced Raman spectroscopy cytology offers a highly sensitive, non-invasive method for detecting neoplastic cells in urine by quantifying target-specific markers, such as the PLZ4 peptide, using an internal control ratio. On the therapeutic front, drugs like sorafenib are being investigated as potent multi-kinase inhibitors targeting key receptors, including vascular endothelial growth factor receptor and platelet-derived growth factor receptor beta, which are expressed in all canine transitional cell carcinoma patients. By disrupting cell growth and the blood supply to tumors, sorafenib represents a promising future option. Ultimately, while this aggressive cancer presents many challenges, the multimodal approach focusing on quick obstruction relief and sustained systemic control offers dogs a good quality of life and extended survival. Thank you for listening. The link for the full podcast is below. Remember to like, share, and subscribe if you enjoy this kind of material. From Vet Med Digest, where we keep minds inspired, hearts light, and tails wagging.